Hello, welcome to the inaugural webinar of the Fédération Internationale Patrol du Ski, FIPS for short. Our organization has representation of patrollers from 18 different countries. My name is Terry Abrams. I'm a Canadian ski patroller from Calgary, and I'm presently the chair of the FIPS Medical Special Interest Group. This year, we've identified patroller professional development as one focus for FIPS. We appreciate the financial support of Helly Hansen through proceeds from International Ski Patrol Day, which again this year is going to be February 10th. We're pleased to share that we have over 70 participants immediately online and 250 plus participants registered for this webinar. Through the poll you're completing, we have representation from a wide variety of countries. The webinar is being recorded, and the recording will be posted on the FIPS website to provide opportunities for other patrollers to benefit from our two expert presenters. All participants are muted. Please use Q&A only to submit your questions. These will be responded to either in the Q&A or will be posed to our presenters in a brief Q&A at the end of their presentations. If you're watching on social media, unfortunately, you will not be able to pose questions. Our first presenter is Dr. Niels Giddins from the United States. He's originally from Canada, though. He's a newly retired pediatric cardiologist and a member of the National Ski Patrol, patrolling out of Smuggler's Notch in northeastern United States. You're invited to refer to our website for more information on Niels' impressive background. As you know, children are not miniature adults, although sometimes we think of them as that. Niels will be sharing valuable information related to the assessment of this pediatric population. So I give you Dr. Niels Giddins.
Thank you, Terry. And thank you to FIPS for inviting me to participate in this inaugural webinar. First, some disclosures. I've been a member of the National Ski Patrol since 2015, and it is with their permission that I have used some of their educational content today. As a volunteer with the Smuggler's Notch Ski Patrol, I would like to acknowledge their skills, spirit, and camaraderie as integral to the joy that I have experienced patrolling these last few years. I must emphasize, though, that I am not a pediatric trauma expert, rather a pediatrician who patrols. I do not presume to have all the answers, and for all of us to be completely up to date, I would strongly encourage regular review of local resource materials and ongoing dialogue with your local medical advisors. Lastly, it's a tall order to summarize this topic in under 30 minutes, especially when we're dealing with the care of several fundamentally different types of patient. These are 5 of the 6 typically described stages of child development. I'm not including newborns over here. And as many of you, or any of you with children know, the differences can be quite dramatic, as infancy is followed by toddler, preschooler, school ager, and eventually adolescence. Not surprisingly, as these individuals are growing, developing, and exploring, they can get hurt. In this country in 2015, there were over 13,000 injuries related to snow sports in those younger than 15, with nearly 5% requiring hospital admission. Of those admitted, the type of injury varied dramatically by age group. These data, published in 2021, show a greater incidence of lower limb, and skull and facial fractures in the younger age group, and a tendency for more abdominal and other types of fractures as we reach early adolescence. So turning to our specific objectives for today, I would like to cover some of the basic anatomical and physiological differences between children and adults, acquaint you with the use of the so-called pediatric assessment triangle, address some additional practical considerations, and hopefully allow some time for questions and answers. Starting with the basics, the ABCs. However, there's also various effects of growth on body proportions, skeletal structure, and behavior. Starting with the airway. The smaller the child, the larger the tongue, relative to the size of the upper airway. Both this and the relatively small larynx or voice box reduces the airway size at multiple levels, increasing the vulnerability to obstruction for any reason. The trachea or windpipe is also less rigid. With respect to breathing, this is typically faster and more diaphragmatic in nature the younger the child. C is for circulation. Children obviously have a smaller blood volume than adults, but may bleed at a same rate, leading to rapid development of the signs of shock, including faster heart rate or tachycardia, pallor with poor capillary refill, and changes in mental status. Decompensated shock, in other words, when the blood pressure drops through the floor, can occur very suddenly in children. As cardiac output drops as a result of, say, major bleeding, there will be a temporary tendency in all of us for our blood pressure to be maintained because our peripheral vascular resistance increases. Here's the cardiac output decreasing on this graphic, vascular resistance increasing, maintaining a blood pressure. As seen in this comparison diagram, the process is more gradual in an adult and more precipitous in a child. The child's physiology behaves more like a lithium-ion battery than the older alkaline type that gradually loses power. Turning to body proportions, a child's head is proportionately larger and heavier, resulting in potentially greater heat loss. And children are already more vulnerable to heat loss because of their greater relative body surface area. There are also implications to maintain airway patency and upper spinal alignment. In this illustration, you can see how raising up the shoulders with some padding has improved both in this young patient. Hyperextension of the neck also needs to be avoided because that less rigid trachea can tend to collapse. Proceeding to the chest and abdomen, children have proportionately weaker ribs and sternum, as well as a thinner abdominal wall, making the thoracic and abdominal contents much more vulnerable to injury. Bones, joints, and ligaments are softer and more flexible, and the growth plates at the ends of the long bones are particularly weak. Various fractures are common at the growth plates and require expert management to avoid later problems such as limb length discrepancy. Other types of fractures in the more flexible growing long bones are illustrated over here. So it is because of these differences that the use of the pediatric assessment triangle has been introduced widely. This guides us to quickly assess a child's appearance, work of breathing, and circulation to the skin. It can be considered a part of scene size-up, allowing a quick determination whether a child is sick or not. It's based on looking and listening, and I can attest to the importance of that approach after years and years in pediatric clinics, where the first touch of a patient can sometimes lead to all hell breaking loose. Focusing on breathing, we need to listen what it sounds like, how the child is positioned, whether there are any chest retractions, nasal flaring, or gasping. Remember, the airways are narrower and more prone to obstruction. Breathing mechanisms are different, with faster rate and reduced musculature leading to early fatigue. On the positive side, crying or screaming at least indicates an open airway. Signs of significant skin circulation problems include pallor and mottling, with cyanosis specifically indicating reduced tissue oxygen levels. While the term cyanosis is derived from the color blue, in people of color, there may be more of a gray appearance seen at the mucous membranes, conjunctivae, and nail beds. Remember, the child's smaller blood volume can lead to earlier shock. Children have a higher metabolic rate, fewer reserves, and their decompensation may be sudden. And as opposed to the adult population, cardiac arrest is most likely the result of respiratory failure. And so if we are alone responding to a child's unwitnessed collapse, 2 minutes of CPR are advised prior to activating the emergency medical system or EMS. In a witness collapse, or if we're not alone, the adult protocol applies with immediate activation of EMS. Completing the triangle is the assessment of appearance and, in fact, behavior. How are they interacting? Are they consolable? We need to remember that all this is affected by their developmental stage and how we are interacting with them. It may be common sense, but it's worth remembering to drop down to the child's level and watch for nonverbal cues and clues. Be friendly, calm, and positive. Be honest and firm. Avoid traps just as "this won't hurt" because it might, or "can I do something? What if the answer is no?" Use plain language. Examine any potentially painful areas last, and involve the family and caregivers as appropriate. Turning to other key considerations in the care of pediatric patients, I've alluded to some already, but I'm going to call these the 6 Ps. First is plasticity. While there's a reduced fracture risk due to bone flexibility, there is an increased risk of energy transmission and thus potentially more internal injuries. Permission and consent should be obtained as soon as possible, with contacting the accompanying responsible adults a priority. Speaking of which, those parents or guardians need to be managed as well, with time and energy devoted to their concerns. In contrast, privacy and independence can be very important to many in the adolescent age group, and that must be kept in mind. Prevention. Terrain design and snow sports area management play a key role in maintaining a safe recreational environment for everyone, but particularly the youngsters. And it would be remiss of me as a pediatrician not to mention helmets that significantly decrease the risk of non-fatal and fatal head injuries, though unfortunately the older the child, it seems potentially the less likely helmets are to be worn. Last but not least, we need to be aware of the potential for child abuse. Clues can include mixed injuries that could be new and old or partially healed, bilateral injuries, bruising of unusual patterns, and historical details that are inconsistent or vague. It's our duty to report suspected cases to appropriate authorities in many, if not all, jurisdictions we serve. So in closing, some take-home or take-to-the-hill points in the framework of the pediatric assessment triangle, again used with the kind permission of the National Ski Patrol. As we come on scene, is the child obviously injured or ill, showing reduced responsiveness, labored breathing, pale appearance, major bleeding, obvious limb deformity, or painful crying? Is the child active, moving, or quiet and still, potentially sitting forward in an effort to protect their airway? Are you able to make eye contact? This is generally a good sign. How do they respond to your voice? Quiet, smiling, and appropriate response is generally very reassuring. Does the child appear irritable or agitated, potentially even in a caregiver's arms? This latter concept is called paradoxical irritability and can mean some significant neurological issues are going on. Some breathing red flags: sitting upright, perhaps in the tripod position, leaning forward on their hands. Also nasal flaring and the labored use of accessory muscles with retractions. This color palette is a reasonable way to think of skin circulation, emphasizing conjunctivae, nail beds, and mucous membranes, normally looking quite pink, no matter who the patient is. Pallor, mottling or gray skin, or cyanosis, all danger signs. And so with that, I will stop. Thank you all for participating. I hope this basic review of an approach to the pediatric patient will be of some assistance to you in your important roles on the mountain.
Great, thanks very much, Niels. If you don't mind, I'd like to interact with you, so if you can just turn on your camera, that would be great. One of the questions that I have is, clearly we don't see the pediatric population all that much, at least not in a necessarily a patroller or a first responder sense. So as a well-experienced pediatrician, do you have any tricks of the trade in terms of gaining better cooperation out of kids and especially their parents? Everybody has the horror story of the wild parent.
Very good question. Sometimes the accompanying people can be helpful, or the accompanying people may not be so helpful. Perhaps in the size up of the situation, that could be clearest, made clear as soon as possible. Because if there are diversions for worried parents, that might be very helpful when we're trying to really understand what's going on with the child. However, the complete opposite could be potentially going on with the only person able to get any sort of reliable information from the child being that parent. It's a play it by ear scenario.
Okay. Great. Thank you. I guess another question that I have for you. I have a question here from one of our listeners, our watchers, our participants. You said to avoid can I statements or can I types of questions. Can you give an example of another phrase that seems to be better, that works more effectively?
Sure. I'd like you to do this, or watch me while I do this to somebody that the child may trust, and we're going to do it with you. You just don't want to break the bond by saying something that can't be believed early on.
Okay. How do you feel about using a surrogate of sort, like small stuffed animals or small stuffed dolls, or as a way of demonstrating what's going to happen?
Potentially quite reasonable in the aid room. Not that we have the ability to take them out of our jacket on the hill. When things are usually most acute. In my limited experience, getting to the aid room, getting to warmth, getting to more comfortable surroundings, getting to a situation where friends or family are around to provide reassurance, that's a big step. And certainly some other surrogate type maneuvers could be considered at that point, but I think the aid room makes a big difference.
Very good. How do you get past some of the invulnerable or sense of invulnerability of teenagers, of adolescents, who seem to have hurt themselves fairly substantially, but just would rather walk it off and crawl their way into the patrol room?
I think a firm, friendly guiding hand toward the sled will usually break down most resistance. Perhaps if they're in a peer group where they don't necessarily want to be seen to be weak or vulnerable, maybe that's an area for some distraction, and get some other people involved to get the group out of the way, and then things will probably go a little more appropriately with the patient and the patroller between themselves.
Excellent. Thanks very much. So I think at this juncture, I'm going to turn it over to Johan as the next introducer.
All right. Thank you, Terry. My name is Johan Pekenplan. I'm a professional ski patroller in Sweden. I primarily work in the town of Hemavan, the Swedish Lapland. I'm also a mountain rescuer, an avalanche dog handler, and an avalanche forecaster. I understand and appreciate how important this next presentation by Manuel is to the lives of patrollers and everyone enjoying outdoor activities in Avalanche territory. And Manuel Genshwein, founder of mountainsafety.info, known worldwide for expertise, his research and training in the area of avalanche safety and rescue. You can refer to the webinar postings for more info on about Manuel and his work related to mountain safety. We are pleased to have Manuel share his knowledge on this most important topic at this, our first webinar. As you're aware, all participants are muted. Please use the questions and answers function only to submit your questions. If you're watching on social media, unfortunately, it's not possible to post questions. But Manuel, welcome.
Good evening, everybody. Good evening, Johan. Thanks for the kind introduction, and thanks for FIPS to invite me to present here on this very first worldwide webinar for all the ski patrols. I hope that you all have a good winter. I was invited to present something about probing and probe line strategies. Just as the very start, I would like to say a few words about mountainsafety.info. That's the initiative which makes all these strategies, system methods, and techniques as worldwide best practice. We have 27 nations practicing in the work groups, and it was important for me when I created many years ago mountainsafety.info that all the different user groups are represented around the table. So the user group of organized rescue, the user group of professional guiding, the user group of the research institutes, the 4.2 million Alpine Club members worldwide, the world of the military mountaineering school, and as we have already several times collaborated with FIPS, of course, you would be very welcome to sit around this table as well. We publish our content in more than 20 languages, and we started with avalanche related topics. Avalanche rescue and first aid for avalanche patients is done. We are now going to work on all the topics related to snow science, forecasting, and risk management. And after next work group who has already started to constitute themselves is concerning glacier and crevasse rescue. So tonight's topic, probing. We see that here on this avalanche there is one single person who has been found with a transceiver. As we see, there are multiple buried subjects. Unfortunately, the remaining transceiver search and RECO search has not led to a success. So immediately one had to decide to start probing. And what we see now is that we have a sequence of actions, the overall probing strategy. So at the very start, we always start with spot probing, the most likely burials areas, such as obvious terrain traps, obvious depression zones in the terrain, and of course around surface clues. So when we look at the overview sheet, here we would have such a probing spiral. Here we would have such a probing spiral behind this rock where it pushed in snow then here around these trees would be most likely spot to get stuck. And as long as you don't have enough resources to really start the probe line, you just try to see if there is a fast success around the most obvious places which you can easily identify in the terrain. Spot probing, you see here the spiral probing pattern, so the same spiral probing pattern in the end, which you would apply at the end of a transceiver or a recco search, where you have found the spot of smallest distance indication or the loudest sound. The only difference here with spot probing is that you would make more spirals, so you would spiral out a much larger distance, so more turns of the spiral. Unfortunately, that did not lead to success, so one had to put in the first probe line, which was here put in downhill in the direction of the flow of the avalanche from these two surface clues. I think a clever choice, maybe 30, 40 meters below the two visual clues. They started probing uphill. We can only probe uphill. We probe 90 degrees to the snow surface, so it would be highly unergonomic to probe downslope. And even if you have to do a second pass, you cannot just turn around. You would have to bring all the rescuers which work in the probe line at the bottom and then start probing uphill again. So there are different probe line strategies, and we always start with coarse probing. And the difference between the three different strategies is, for the first two, complexity of the terrain or foot penetration, and then for the last option here, basically the criteria is when there is no pre-existing training because you need to use bystanders. Slalom probing here at the very left is always your first choice. If there are no terrain restrictions, you absolutely should apply slalom probing because it proves to have the highest probe holes per minute per rescue rate. And when you have different probing systems with the same resolution, here about 50 by 50 centimeters, then obviously the one with the highest amount of holes per minute per rescuer over a longer time is the most efficient approach. The backup method would then be 2 holes per step. Difficult terrain would be a criteria. You are in a forest, there are big, large, very hard blocks, or there is a lot of foot penetration. In this case, if it's not too steep, you should as well consider to make people probe with skis, with skins, or snowshoes. Let's quickly look at slalom probing. It needs some initial training and very complex terrain features, or a lot of foot penetration is not optimal because you need to do steps sidewise. Concerning the trained personnel, I must, however, as well say that I think you can really train people in very few minutes to be able to do that. There was a successful survival case of probe line in a Canadian ski resort just very few years ago, where the ski patrol decided to just on the spot train the bystanders, and very few minutes later they made them apply the probe line, and they had a probe hit and the buried subject survived. So here everyone is responsible for a 1.5 meter wide carpet, so it's a 3 hole per step approach. And as you probably are aware of, the more steps or the more holes you do in the same line before you do a step forward, the higher is the probe hole per minute per rescuer rate. why this exactly is the case, it is not known, but it has been proven in many publications that the more holes you make on the same line before you step forward, the higher is the efficiency of the system. So you see here these 1.5 meter wide carpets, which indicates as well how much terrain you can cover, even with quite limited resources. You see here the different commands. I think I only want to say a few things about some of the generic things. For example, when you start probing, you always say probe, and the rescuers probe always in the most left hole of their probing sequence. And because for the first order, they only probe, but there is no displacement of the probe or the rescuer forward or sidewise. There is no command like right or left, which would indicate the direction. For all the other commands, you only command the direction, and then every rescuer working in the probe line probes automatically him or herself. So it's it doesn't not make sense to say right probe, forward probe. They probe themselves. And don't wait until everybody has put the probe forward and only then you say forward. Very high criteria on synchronization does not make sense. It doesn't impose a problem if someone is half a second or 1 second behind the others just because very locally the snow is a little bit softer. It is not a military parade. It needs to save lives. And if you put too high expectations on the precision and how synchronized people need to step forward, you kill the efficiency because you kill the flow. Probe lines need to move forward with flow. And if they don't, then the efficiency and therefore the amount of probe holes per minute per rescuer rate goes down. First passage, we probe down to 1.5 meter. Second passage down to 2.5 meters. In mountainsafety.info, we firmly believe that as well in mountain rescue and other mountain safety related topics, we should not base everything only on expert consensus. So we always try to find rigid quantitative evidence for what we publish as best practice. And you see here, for example, the paper which stands behind slalom probing and this 1.5 meter recommendation concerning how deep we probe in the first passage. And behind that is obviously the fact that the deeper the burial depths and the longer the burial time, the more you see the dots here turning into blue. These are those ones who are deceased. And the more we are in shallower burial depths and shorter burial times, the more the dots are red and the people have survived. So you need to find an optimal balance between how much time it will take you to find a certain percentage of buried subjects with the goal to achieve greatest good for the greatest number. And applying Monte Carlo strategies to simulate what really happens, 1.50 meter turned out to be providing greatest good for the greatest number. And you see here, by the way, how much burial depth, how much survival chances decrease for every meter a buried subject. You are deeper. I just mentioned this quickly because in the first 20 minutes, the difference is greatest. It's almost a fifth of a life, 18% for every meter you're deeper when you are in the first 20 minutes of burial duration. This is then slightly getting smaller as you imagine when you're already more than an hour in the snow. If you are below 50 centimeters or 1.50 meters, you have probably simply asphyxiated, and the difference in burial depth does not influence survivability so much. It's an important message for you, because the ski patrols are the fastest organized rescuers on the Avalanche, and therefore many of our rescues fall exactly in this first 20 minutes. And in the first 20 minutes, the impact of burial depth to survival chances is very considerable. So if you arrive and you are in shortage of resources and there are multiple buried objects, don't dig if someone is 150 centimeters and deeper. It goes back to the same considerations. Backup method, 2 holes per step. We have spoken about the criteria. Complex terrain, a lot of foot penetration. As the rescuers need to walk in a straight line here, they can only cover a 1 meter wide carpet. So 2 holes on the same line on a 50 by 50 centimeter grid. You see that the probe still does a slalom here. It's important to keep certain things always in the same way. This makes it easier in the learning process. However, the rescuer himself or herself goes in a straight line, and that makes the system more compatible to more complex or more challenging environmental conditions. As well here, first pass 150, second pass at least 250. What does that mean? First pass 150, you need to make sure that your probes have a high quality tape in a contrast color mounted at 150. Otherwise, it's impossible to recognize this point quickly. So the point where you need to retract the probe again. Use a high quality tape, put it 1.5 times around the probe like that. It does not build up too much diameter, so there's no friction to make it wear off very quickly, but it needs as well 1.5 times. Otherwise, there is not enough area which sticks and it falls off too quickly. 1 hole per step, the last approach. This is recommended when you have to do it with bystanders. Absolutely no training, communication issues, people of different languages. Shoulder to shoulder like that, you really can't make something wrong. In this case, the probe line leader is not embedded, and the Avalanche professionals, the ski patrol, would play the role of the probe line leader, the backup and verification team. And here you can use less trained or non-trained people, complete bystanders. I think when there is a larger event, one should never forget there are never enough ski patrol to just solve the situation when it needs probe lines. Suddenly, one has to look at the bystanders, the skiers, the free riders as a resource, which means you should plan to have probes for them. And for the first passage, you can really work with normal alloy probes, which are easy to put together. Screwable probes are for bystanders not very adequate because you need to retighten them. They're very heavy. Just take normal 240 alloy probes. With them, everyone can easily probe and become a resource very quickly. Here, the pattern is 60 by 60. This is given by the width of standing shoulder to shoulder. As well here, first passage 150, second passage at least 250, which means as soon as you come to the second passage, then you in fact need screwable probes, at least 350 in lengths, because if you have to push the probe all the way into the snow, it becomes terribly inefficient and the amount of probe holes per minute per rescuer rate goes down dramatically. Time probing, fortunately, not very often used, so that comes into play when the first 2 passages, of course, probing did not lead to success. what is kind of the effect of fine probing? When we look at the generic search series here, we clearly see that when the complexity increases, and this is with every kind of search mean, the RECO, the forward-looking infrared camera, the transceiver, but as well the probe line, when the complexity increases, you need to slow down, put more priority on precision, and you need to tighten the grid. You need to apply a higher resolution search system. So basically, if the first two passages did not lead to success, you have to rate the complexity higher. Maybe an unfortunate case of a vertical buried subject. So first you did work with coarse probing, then you tighten the filter to fine probing. So you follow the advice of the generic search series. And what is really the output of that? You see, when we push here from the left to the right, as we are tightening the grid, the probability of detection is increasing, but it doesn't come for free, because the currency we pay in is basically surface search speed. So the more we push here from the left to the right, the slower the probe line advances. And in a business where, yeah, every minute is 2 to 3% survival chances for the first 35 minutes. One needs to find a good balance. When can we afford to have a lower resolution system, and when unfortunately we just have to decide everything else didn't work, you have to use a high resolution search system. Here again the same, you see the slalom. The probe makes a slalom, the rescuer goes straight ahead. He's standing here shoulder wide with the feet, which is a good base position, as the tip of the feet are 50 centimeters apart, and therefore with probe center right, forward, center left, you command and the probe line will go forward. It is recommended in this situation to have an external probe line leader and a backup verification team. Here you're usually already many hours into an organized rescue mission. Full probe lengths at least 3 meter burial depths. Marking the probed area, we see here for example, slalom probing. So we have an integrated probe line leader that has as well the advantage that the probe line leader feels himself, herself, how hard it is to probe where you are currently standing together with the other probers, and you automatically adapt the pace in a much more natural way to how hard it is to probe where you are currently in the terrain. So you see here the flags on each side of the probe line, on each extremity of the probe line. When someone indicates here a probe hit, don't lose time. Don't make sure that not everyone is waiting to verify the probe hit. Immediately, these two outer positions flag. That means we see that we lose one person here in width. The second last person from the left was walking behind the probe line, immediately passed his probe to the person who indicated the potential probe hit. Immediately the probe line leader goes forward so that 9 people continue the work, and the one person here will verify the probe hit as soon as the probe line has moved 1 or 2 steps forward. All these illustrations you see here, you find, by the way, in mountainsafety.info in about 20 languages. When you have the luxury that you have a lot of people, or you have to do it with less experienced people, then the avalanche professionals, such as the ski patrol, they are here playing the role of the verification team and the probe line leader. So then the task of marking and so on does not need to be done by those ones who are actively probing at the same time. Just an outlook on one or two other mountainsafety.info projects. Last year, we were able to systematize the entire organized rescue process in a almost flowchart or algorithmic manner. So you can just work yourself through a series of questions selected in first in the question, do we search only terrestrially, or is there an option to make an airborne search, or even the necessity to do an airborne search because the residual risk would be simply too high. We have here at the top as well the risk benefit perspective, which is very important. Then here the systematization of the entire terrestrial search process with all the different search means we have available. And at the end, a few key points concerning excavation here based on the snow conveyor belt strategy. Once we have the patient, maybe you want to have a look once at our Avalanche protocols. It's published in 3 versions, the ALS and the BLS organized. The BLS organized rescue version would be the 2 which would be adequate for a ski patrol, here for people with a higher level of medical qualification, and here for a standard ski patrol. We just published another paper concerning Avalanche, and this paper includes as well all the simulations and considerations how burial depth influences survivability. It is an open paper, so if you want to make a screenshot here, you can download that for free. Thank you very much for your attention. We have a look at the Q&A window here.
Yes, thank you, Manuel. You're doing a great work. It's super clear, but we can take some questions here. First, quick question about the slides. Will they be available for download?
I mean, I cannot entirely answer this question, but as far as I understand the strategy of FIPS with this webinar, you will make this webinar available to have a look at it later on as well for all those ones where it was now just in the middle of the night, or they simply didn't have the time to join us now. So I think post viewing is possible, and then you see all the slides again together with the comments and the explanations. Otherwise, you can look at all the content at mountainsafety.info, and if you really want to use it then in your ski patrol, yeah, we would appreciate if you would take a subscription and pay a small development amortization fee, which simply is necessary to do research and development on this level of technical correctness, of making it available in more than 20 languages, of making it as well completely brand neutral. We are very strict concerning this. So when you look at these systems, methods, and strategies, they are as they are because hard quantitative proof has shown it. And to get to that, it needs a lot of field testing. It needs sometimes laboratory testing. It needs extended study of statistics, and it's a full-time job. You cannot just do that kind of as a hobby, and therefore it is it is a joint adventure, and those ones who want to use the data need to contribute something very little.
Yeah.
Other questions?
Yeah, we have a technical question here. Interesting. Why do you put the probe at 90 degrees and not straight?
this is very simple. When you probe 90 degrees to the snow surface, independently of the slope inclination, you always probe at the same depths. Plus, as soon as you stand on an inclined slope, the thing is that it is as well much more ergonomic, because when you push in the probe vertically, so straight down, as you did many years ago, what will happen is when you push the probe in with a certain force, it always pushes you as well a little bit backwards. And to compensate that, the rescuer needs to make a slight movement towards the slope. So if you probe 90 vertically down, as we did in the early days, and you take a video of a probe line looking at it from the side, you always see how the probes get bent forward. By applying the probe 90 degrees to the snow surface, the force vector, which allows you to stabilize your body position, and the vector in which you need to probe are pointing in the same axis. So basically, it's more ergonomic, and independently of slope inclination, we always probe at the same depths.
Right. Yeah, good.
Look at the paper, which was shown at about 1/3 into the presentation. There you see really in detail all the considerations and the field tests results which have come up with the 90-degree recommendation. And I think all in all, today we can say, as soon as we use an avalanche probe for avalanche rescue, it's always 90 degrees to the snow surface. And when we have such consensus and standardization across user groups and user levels, alone that is a big advantage, because it makes teaching and the application rules much more simple.
Right. Yeah, that makes sense. Okay, I have another question about probing. We have some other questions, but considering probing, do you know statistically, are victims often found above or below visual objects on the surface? I mean, you talked about where to start your probe line in respect to where you find objects on the surface.
Yeah, I can't give you now a percentage, but there for sure is a very clear relation between the position where surface clues are found and the position where buried subjects are found. What is a very important criteria for me looking at an avalanche and trying to decide where do I put in the first probe line is very much the terrain shape and the flow of the avalanche and depression zones. So this for sure is equally important than the visual clue, because the terrain shape really decides where the mass is flowing. So read the terrain very well when you need to decide where you put in your first probe line, when you have on the top of it indications from a last seen point or entrance tracks. That obviously helps on the top of it.
Right.
Maybe one more thing concerning the tools. We published about 1.5 years ago in the UIAA Safety Commission the most recent standard for avalanche rescue tools. It's the first standard for avalanche probes. The UIAA safety label you maybe know from ropes, from harnesses, from climbing helmets. In the last few years, we developed 2 new standards, one for Avalanche shovels. It came out already in 2017, if I remember right. Today, there are more than 30 products which are certified on the market now. Very new, there are Avalanche probes which are certified. Don't spend 3 evenings with gear reviews on the internet. Buy UIAA safety label products, and you're sure that you have a product which had to pass a rigid test, which makes sure that there is some longevity and the product doesn't fail when you absolutely don't want it to fail because you need it to save a life. In a business where every minute is 2 to 3% survival chances, there are certain mechanical and stability minimal criteria, there are certain ergonomic minimal criteria. And for example, to be certified, the last and lowest segment needs to be in a distinct contrast color to all the other segments, so you can dig full speed without any hesitation to hurt the buried subjects. No need to look on the centimeter scale all the time. And as soon as you see now the color changes, then you start to be more careful, because you know very soon the buried subject will transform into a patient.
Right. I think those are good closing words. We have some more questions, but time is running. So I think this shall conclude our first PIPS Pro webinar. And I'd like to thank those who did a great job behind the scenes in organizing: Duncan Isaacson Loxton, Charlie Turner, and Brian Lowe. And thank you to excellent presenters, Niels Giddins and Manuel Genshwein. And thank you to Helly Hansen, like Terry said, for their support to PIPS and helping make this webinar possible. And most importantly, I think thank you to all of you who have taken the time to learn more and to become even more skilled and knowledgeable ski patrollers. Remember the post-webinar survey, which will show up on Zoom. That will help us a lot to make future webinars even better than this one. And please look forward for news on future PIPS Patroller webinars on the website. I'd like to say a few words on the Ski Patrol Sweden's project with hosting the PIPS World Congress in Riksgränsen, Sweden. It's 300 kilometers north of the Arctic Circle. And that's taking part in April 2024. And everybody is most welcome to join us there. So please check out the PIPS website for all the details coming there. And we hope to see you there. So on behalf of Terry Abrams and myself, Johan Peckenstam, good morning, good afternoon, and good evening to you.
Bye-bye.